This is an excerpt from 3CR's Enpsychedelia. We broadcast live each week from 3CR Community Radio. You can hear us on 855 AM or stream live at 3cr.org.au. You can also find us on Facebook and Twitter and subscribe to the podcast at 3cr.org.au/Enpsychedelia or alternatively at our website at enpsychedelia.org.
Our Residents for Victoria Street Drug Solutions formed in about October 2016, so we've been in operation now in the community for 3 years. And we had 4 key objectives when we set up our association. The first one was community education, and we ran monthly meetings for the public in a warehouse throughout late 2016, 2017 and early 2018. The other 3 key objectives were that we wanted to save lives in our community, we wanted to reduce the call-outs to our very precious emergency services, and the fourth one was to improve the amenity of our long-suffering and fragile community around North Richmond and South Abbotsford. We always had a bit of a long game view of these objectives, particularly the improved amenity, but you have to start somewhere, and the very first place to start for us was to lobby for a medically supervised injecting room and addressing an elephant in the room which had not been acknowledged for many years. That's right, correct. We always knew that this was a very complex issue and potentially going to cause discussion, and so it should in the community. And I was also alerted to that by a similar group to ours that existed in around Potts Point when the Sydney Injecting Room opened. So they said that's what will happen, and it is exactly what's happened. Currently at 300 a day, supervised injections.
And has that gone up since they got the standalone facility?
That's right. So that's increased. But they're injections that no longer happen in our laneways and carports. We never said this was a silver bullet. We knew that this was going to take a long time for it to be bedded down, and also to get the confidence of the people that are using illegal substances. So for them to have a leap of faith from injecting in my laneway to actually taking their substance into a supervised facility was just something that it does take time. One of the things we're looking at and doing some work on based on evidence, all evidence-based, and what they do overseas, is perhaps an after-use drop-in centre for people who leave the centre. Now, there's no policing of people when they leave the centre, and one of the issues that's come up through the trial is that people have been a bit unhappy about the congregating of people who are leaving the centre. So we're looking at how they do manage that issue in places like Canada. The other one was, of course, extending the hours of operation, and that's going to be really important coming up to the warmer months. As we know, people are injecting later into the evening because of the daylight savings. So we're looking at possibly encouraging the department to support the injecting room to open for extended periods. Also, the drug law reform report that was tabled in the Victorian Parliament in 2018 had a recommendation for the implementation of a trial of a hydromorphone program, which is for people, and I'm non-medical, and so I had to write this down what it is, but it's an opioid substitution therapy program, and it had cross-party support. Back in November 2017, the independent Canadian Senator Larry Campbell was visiting Melbourne, and he was the Mayor of Vancouver when they introduced their first injecting room, and he told me when he was in Melbourne that when they established that first one, they should have established 5 at the same time. Yep. And now I totally understand what he meant by that, and we should have too, but of course we were so grateful in many respects just to get one. Yeah. But really the need is very broad, and I really feel sorry for people living in regional Victoria that really have very few places to go. But of course, the government also announced that it would be extending funding for extra rehab services, which are sorely needed across the sector. So they're also, clearly solutions to this issue. We want to get people in there and who want to get off their addiction to give them the support that they need.
If you want to know more, follow us on Facebook and Twitter and subscribe to the podcast. 3cr.org.au/Enpsychedelia or enpsychedelia.org. Or tune in, we broadcast live each Sunday from 2 p.m, 855 AM on your dial.